Hello, welcome to DocDano.com. I'm Dr. Dan McCoy, and I'm here with Marcy Crouch today. We're going to talk about physical therapy, maybe in a new way. Marcy, tell me a little bit about the physical therapy that you specialize in.
Sure. I am considered a women's health physical therapist. My specialty field is treating men and women who have bowel and bladder dysfunction, constipation, sexual dysfunction, and other things that kind of relate specifically to the pelvis.
Now, this has got a name now. You call this what kind of physical therapy?
Pelvic floor physical therapy, or women and men's health.
Now, I haven't seen this. This is a new field?
It's growing, absolutely. The women's health section of the American Physical Therapy Association is relatively new, and we're growing in the United States. Back in Europe and some other countries, it's mandatory for women to have physical therapy after they have babies, but here in the United States, it's not as prevalent. So it is a new growing field here, but we're trying to get the word out and market a little bit better.
So what grows the field? Is it that current ways of treating these disorders aren't effective, or is this just an alternative?
It's a conservative treatment approach. The physical therapy that we do is extremely effective, and we have a lot of clinical trials and research to back our techniques and our interventions. So it's absolutely effective. It's just a lot of times I feel that people don't really like to talk about it as much because it's an intimate subject, and they don't really like to discuss with their healthcare providers or their friends that they're having some type of urinary or fecal leakage or rectal pain or pain with sex.
Now, you mentioned before that it was mandatory after childbirth to have this. It seems like today, most of the recommendations I hear now, I'm not an OB-GYN, but when I went to medical school, and I remember almost those things are an afterthought. I mean, basically women get told to do Kegel exercises after they have a baby, but there's no real instruction given. So is that... That's
where we come in, yeah, and unfortunately that's very common, and that's kind of where physical therapy is able to come in and really make a difference for these women. You know, it's fine to tell somebody to do 100 Kegels after you have a baby, but you wouldn't go into the gym and do 100 bicep curls if you don't have the strength to lift your arm. So it's kind of the same analogy. We are looking at the muscles of the pelvic floor, and we're trying to rehabilitate them so they're functioning properly. When a woman has a baby, a vaginal or C-section delivery, a lot of trauma happens to the pelvic floor, and it's like a surgery, so they need to be rehabilitated properly.
So what happens if you don't have rehabilitation right after you have a baby?
It depends. Everybody's a little bit different, but some of the common symptoms that I see in my patients are urinary or fecal incontinence, pelvic organ prolapse, pain with intercourse. Sometimes if there's an episiotomy done during the delivery or some type of assisted delivery like a forceps or a vacuum, there'll be more trauma to the pelvic floor, which then will result in more side effects that aren't very well taken.
So I guess you've got two groups of people that you deal with. You've got women, for instance, who are post-baby, and then you've got women who are years after children who have the problems that happen, like you talked about organ prolapse.
Right. I see a lot of women either right away after they have a delivery, which is great when I love to get them, and then I also see women who have had babies 30 years ago that are still having some type of incontinence or some type of pain. So, you know, I would like to get everybody young and early and be preventative and strengthen and rehabilitate them in the early stages to perhaps offset some of the more devastating things that can happen later in life.
And if you intervene early, then you can prevent these things that happen later.
Absolutely, or at least decrease the impact on their lives. We have a lot of literature and evidence to show that if you begin strengthening and taking care of your pelvic floor during your pregnancy or even beforehand, that you're set up for success after delivery. So I see a lot of women who are pregnant or trying to get pregnant, and we work on strengthening them right away, even if they're not experiencing any leaking or any type of dysfunction now, but almost as a prophylactic measure.
So how effective are these techniques for, say, an older woman, 65 years old? I mean, do these women need to go have surgery and then see you, or is there an opportunity that maybe they could avoid surgery?
There is an opportunity to avoid surgery. It depends on the patient. Each woman is different, and it depends on the severity of the prolapse or whatever dysfunction we're seeing. But I like to see my women first before surgery to see if we can make a difference conservatively. And if they feel therapy or therapy just isn't adequate enough, then we'll refer them back to the physician, and sometimes they will have the surgery. And then we like to see them after surgery as well to continue strengthening and help them kind of get back a little bit quicker.
Now, you mentioned men,
Yes.
so I guess there's lots of trauma there too, prostate cancer surgery, other things like that. So how does that do? Do you have a lot of men patients?
I do. We see quite a bit of men in our practice. I see a lot of men after prostate cancer who are experiencing urinary leaking, rectal pain, pelvic floor spasm, or dysfunctional voiding. I have a lot of the same issues that women have, men experience as well.
What about post-prostate cancer incontinence? Is that helpful with your procedure?
Absolutely. Yeah, those men make up a large part of our male population.
Okay, we've talked about the pink elephant in the room, but tell me how it works. So what do you do when as a physical therapist?
Right.
What do you just teach, or are there actually techniques or procedures that you do?
Absolutely. The techniques that we use in physical therapy are not that different from what other physical therapists use when you're going in to rehabilitate your knee or your shoulder. We just happen to be working in a different place. So we use techniques like manual physical therapy, like soft tissue mobilization or connective tissue mobilization. We do a lot of patient education, postural mechanics, strengthening of your pelvic floor. We do bowel and bladder diaries to look at what your bowel and bladder habits are. We just have kind of a comprehensive approach to treating everything that could be contributing to the dysfunction.
So what's the biggest barrier to entry into this kind of physical therapy program? Is people are uncomfortable because of the intimate setting?
Yeah, it is a very intimate setting, and I think a common tale that I get from a lot of my men and my women tell me that they feel uncomfortable discussing this with their providers, like we talked about earlier. So I think making the patient feel comfortable and letting them know that a lot of people are going through this and it's not normal. So many of my women say, oh, my doctor just told me that I should just have a glass of wine and sex won't hurt anymore. And that's actually not the case. Just because you're experiencing this doesn't mean that you have to go through your life experiencing this. There's conservative measures that can be done to help you.
There's probably some women that feel like it's normal.
And a lot, and it's interesting because it's starting to change a little bit. The younger women that I get who have pain during pregnancy or incontinence afterwards are kind of like, why is this happening? I don't want it to affect my life this way. And so they ask about it. They do a little bit more proactive research and they find us. Some of my older women or who have had babies maybe 10 or 12 years ago say, oh, well, my doctor just told me that it's just what happens after I have a baby. I just have to live with it. And that's very frustrating to me as a clinician because there's resources out there to help these women and men, and it's effective. So I want them to come into therapy.
Well, this blog is watched by people all over America and all over the world, really, looking at our statistics. So what do you do if you see this blog and you're interested in this therapy? What resources are available to people to find a therapist, for instance? Yeah,
absolutely. There's the American Physical Therapy Association is our governing body, and they have a link on their website, which is apta.org, that says Find a Therapist. And you can search by region of where you live in the United States to find a women's health therapist. The name is misleading because we don't only treat women, we also treat men, but it's just under the title of women's health. And you can Google and search for pelvic rehabilitation physical therapist, but make sure that you call and interview and ask your therapist what their credentials are and what kind of training they've gone through to make sure that they're treating you appropriately.
Great. Marcy, thanks for being here today.
Awesome. Thank you.
This is an interesting topic, and I suspect a lot of people don't know a lot about it. So thanks for sharing with us today.
Thank you for having me.
Well, this is Dan McCoy, and welcome to dogdental.com, and thank you for being here with us today. And we'll be back again with more information about your health.